Most people actually think high blood pressure is caused only by salt or genetics, but there are several hidden triggers that can keep your blood pressure elevated, even in people that are trying to live healthy. So, we're going to talk about these triggers and a lot of this that I see in practice. The first one is sodium. A lot of times we think that the sodium content actually comes from the salt that we add to our food. It actually comes from other things like processed foods, daily restaurant meals, bread, sauces, even some of the food that we eat that actually don't taste like there's salt in it. There could be high amount of sodium in those foods. So we need to watch what we're eating. Another thing that I come across in practice is when we talk about stress. When your body is under chronic stress, there is constant release of hormones like cortisol and adrenaline. These hormones keep your body in constant high alert states, and this can raise your blood pressure over time. We'll also talk about sleep. Sleep plays a major role in regulating your blood pressure. People who sleep less than 6 hours constantly will have their blood pressure elevated. And also keep in mind that if you have been diagnosed with sleep apnea, you can have persistently elevated blood pressure if that is not taken care of. We also talk about alcohol. Frequent or heavy alcohol intake can raise your blood pressure over time. Even moderate intake, if it's consistent, can contribute to some elevated blood pressure in some individuals. Now let's talk about, this is actually big, medications. Some medications that you take, that's why you always hear your doctors, they'll tell you that you need to let your doctors know what medicines that you're taking over the counter. It's very common for us to take the decongestants over the counter, NSAIDs like the ibuprofen or the Advils, and some hormonal medications as well can raise your blood pressure. That's why it's always important to review your medications. I would encourage you that whenever you go to your doctor's appointment, take your medication bottles with you or a list of all the medications that you take, including over the counter medications, so it can be reconciled and then you can get the appropriate guidance from your healthcare provider. Another trigger could be sedentary lifestyle. Lack of movement affects how flexible and responsive your blood vessels are. Regular physical activity helps improve circulation and supports healthy blood pressure. So I encourage you to walk around, do your exercise regularly. Weight changes is also another trigger. Even if you gain few pounds consistently, it can contribute to increased blood pressure. That is why we always recommend weight loss when you have a BMI of greater than 30. For the most part, is always good to keep fit so you can actually maintain your weight or prevent it from getting going higher than what is already is. The good news is that even small amounts of weight loss can improve blood pressure significantly. So, high blood pressure is rarely caused by just one thing. Just like I've already mentioned, it is usually a combination of lifestyle, stress, sleep patterns, the medications that you take, and other metabolic factors. So, if you're struggling with your blood pressure, it may be worth looking deeper instead of just focusing on just one cause. If this has helped you, make sure you check out other videos in this series where we'll break down other conditions and other things related to high blood pressure. Thank you.